colleagues, distinguished guests, and fellow innovators in the field of healthcare. My name is Dr. William Boone. I am a cardiovascular radiologist at the University of Pennsylvania and the Chief Medical Officer at RadAI. It is my great privilege to be here today to present at the first international conference for applications of artificial intelligence in healthcare, hosted by the esteemed Faculty of Medicine at Suiss Canal University. I want to extend my sincere gratitude to Conference President Professor Ahmed El-Saka, as well as to Conference General Secretary Professor Ahmed El-Sarafi for organizing this insightful gathering and the invitation to speak. Today, I'm excited to present to you Beyond Pixels, Improving Radiology Workflow and Efficiency Using Machine Learning and Generative AI. This presentation will not only explore the cutting-edge applications of AI in radiology, but also aim to unravel how these innovations can revolutionize our approach to healthcare. I look forward to engaging with you over the next 20 to 30 minutes, sharing insights, discussing opportunities, and exploring the challenges that lie ahead. Thank you for the opportunity to be part of this groundbreaking conference. As a financial disclosure, I am the Chief Medical Officer and a shareholder at RadAI. As we venture into the realm of AI in radiology, it's important to acknowledge the significant attention that pixel-based AI has garnered. These are the systems that emulate the radiology side, distinguishing patterns and anomalies within the pixels to detect and diagnose from medical images. Their capabilities are indeed groundbreaking. However, the scope of my talk today shifts the spotlight to the often less discussed, yet equally vital non-interpretive roles of AI. Radiology is not only about interpreting images, it's about a complex ecosystem of workflows, quality control, and patient safety, all which bear the potential for enhancement through AI. In our field, we face considerable challenges in streamlining operations to improve efficiency, maintaining the highest standards of quality, and ensuring the utmost safety of our patients. AI offers us tools that are not only sophisticated, but also increasingly necessary to navigate these challenges. Throughout this presentation, we'll explore the transformative effects of AI on radiology beyond pixel interpretation. From optimizing scheduling to automating protocols, from ensuring follow-ups to facilitating smoother billing processes, AI has the capability to touch every facet of our practice. Let's start by imagining a typical scenario in healthcare. A patient, we'll call him Jonathan, visits his primary care physician, Dr. Ali, who needs to investigate Jonathan's symptoms further. In the past, Dr. Ali might rely on standard ordering patterns or consult written guidelines to determine which imaging study would be best for Jonathan. AI has the potential to revolutionize this decision-making process. It can analyze Jonathan's detailed clinical history, prior imaging results, laboratory data, and even nuanced information buried in the EMR, details that might have been overlooked due to human time constraints and the sheer volume of data. With AI's personalized guidance, Dr. Ali can now ensure that the imaging study chosen is tailored specifically to Jonathan's unique clinical scenario. This precision not only enhances the quality of care, but also streamlines the utilization of imaging resources, ultimately leading to cost savings and a more focused patient care journey. Here's a practical application of AI in clinical decision support, published as a case study from the University of Virginia Health System. In an initiative to enhance the radiology department's workflow, the university implemented an artificial intelligence-based tool specifically designed to augment the clinical decision-making process. This innovative AI system translates free-text imaging orders into structured indications, effectively bridging the gap between a clinician's assessment and the most appropriate imaging study. The key takeaway from this implementation was the significant ease it brought to the ordering providers. The AI tool not only recommended the most suitable structured indications based on the comprehensive EMR data, but also allowed clinicians to share specific clinical narratives, which had been lost in translation with the previous, more manual systems. Moreover, this AI-driven process was met with preference by the providers, marking a departure from the restrictive and time-intensive drop-down menus of traditional CDS systems. The simplicity and intuitive nature of the AI guidance led to improved adherence to structured indication selection. The impact of this system has been multifold. It has optimized the relevance and specificity of imaging orders, directly leading to improved imaging utilization, and it has streamlined workflows for both the referring physicians and the radiologists. AI can help tackle another time-consuming activity for radiologists: protocol map. Traditionally, this has been a very manual, time-intensive, and laborious process. AI systems can be leveraged to transform this process, performing detailed review of clinical indications, prior studies, and additional patient data. Once Jonathan's exam has been scheduled, an AI protocoling tool can help determine the most suitable scan protocol tailored to address the specific clinical question posed by his symptoms. This can improve modality utilization by ensuring the scanners are used to their utmost efficiency, providing the most diagnostic value and avoiding unnecessary sequences. In this study published in the Journal of American College of Radiology by Riker et al., a machine learning classifier designed to automate CT and MRI protocols was trained on over 18,000 exams. Nearly 70% of the exams were able to be protocoled automatically using the AI tool with greater than 95% accuracy. The remaining 30% achieved 92% accuracy when used in clinical decision support mode in conjunction with the radiologist. Moving into the scanning suite, AI's role extends to assisting technologists in automating the scan acquisition process. AI tools can automatically set sequence parameters and field of view. This automation reduces preparation and scan time, optimizing utilization of imaging modalities. Furthermore, AI brings advanced scanning techniques to more locations. In facilities where technical expertise may be scarce, for example, cardiac MRI acquisition, AI steps in to guide the technologist through the complex process, broadening the availability of these scans to more patients. Lastly, AI accelerates scan acquisition, a leap forward in efficiency. For MRI and PET, where patients can spend up to an hour or more on the table, AI-driven methods have proven to reduce acquisition time significantly without compromising diagnostic imaging quality. This paper by Vascular et al. Discusses an innovative deep learning framework, specifically an attention neural network, developed to automate the MRI field of view prescription. Manual FOV prescription by technologists is variable and often inconsistent, sometimes capturing too much space or missing crucial anatomy. This AI model determines the optimal region of interest for MRI scans more accurately and consistently, thereby enhancing the scanning process. By using an intrastack shared feature extraction network alongside an attention mechanism, the AI can focus on the most informative image slices and define the best possible FOV. This resulted in an average ROI position error of just 9 out of 512 pixels, similar to a radiologist, and an approval rate of 92% from experienced radiologists. In research published in European Radiology Experimental, Yuan et al. Investigated AI-assisted compressed sensing, or ACS, to enhance MRI scans of the ankle, a joint with complex anatomy where high resolution is critical. By leveraging an extended convolutional neural network combined with conventional accelerations techniques, this AI-enhanced method overcame limitations of parallel imaging and traditional compressed sensing, which compromise image quality and introduce artifacts. Their ACS method reduced acquisition times for various weighted sequences by over 30%, without degrading the signal-to-noise and contrast-to-noise ratios, maintaining excellent image quality. In radiology, the importance of quality assurance, or QA, cannot be overstated. It's the backbone of high-caliber, consistent imaging and patient safety. Yet the reality is that QA processes can be laborious and challenging to maintain. AI is practically tailor-made for these processes, automating and reinforcing these essential QA tasks. AI systems can continuously monitor and analyze imaging protocols, adherence to safety guidelines, and calibration of the imaging equipment. By flagging discrepancies and facilitating real-time adjustments, imaging. Moreover, AI's ability to learn and adapt continuous improvement in QA processes. It can identify patterns that may indicate equipment degradation or shifts in imaging quality, prompting preemptive maintenance and adjustments before they affect patient outcomes. This not only elevates the quality of imaging, but also enhances patient safety, ensuring that each scan is performed within the most stringent safety parameters. This study, published in BMC Medical Imaging, demonstrated the ability of deep learning to automate QA processes for MRI. Researchers developed and tested AI models using the ACR Phantom to ensure MRI scans meet the high standards set by the American College of Radiology. The study explored various custom convolutional neural networks along several pre-trained models. These models underwent rigorous training to accurately assess MRI images for geometric distortion and spatial resolution. The novel approach involved classifying images into categories based on the clarity and number of visible spokes, a method for assessing low contrast resolution. The deep learning models reliably detected QA issues, surpassing 80% precision in identifying geometric distortions and spatial resolution, and also highlighted the model's adaptability and precision in evaluating low contrast conditions, achieving impressive accuracy and F1 scores. Now that Jonathan's examination has been acquired, it can be prioritized using AI on the radiologist's work list. AI work list optimization can take on several roles, ensuring the right study is read by the right radiologist. Prioritizing the most critical and urgent examinations, not only based on stat status, but also based on AI imaging findings. And finally, evenly distributing the caseload amongst radiologists, fostering a balanced and fair work environment. Using deep learning, an AI-enabled work list considers the varying levels of expertise, subspecialty, exam complexity, and daily workload, thus promoting a more efficient and equitable distribution of cases. Here's a real-world example of how AI work list optimization can reduce time to treatment. A study highlighted in the AJR explored how AI can reprioritize radiology work lists to fast-track the reporting of CT pulmonary angiograms for evaluation of pulmonary embolism. PE-positive CTs that were detected by AI algorithms were reprioritized to the top of the radiologist's work list. During the AI-enhanced phase, the average report time for PE-positive examinations was reduced by nearly 12 minutes compared to control, a substantial improvement leading to earlier intervention opportunities. Hanging protocols define how images are displayed on a radiologist monitor. Traditional hanging protocols have their challenges. They depend on a rigid set of rules and specific naming conventions, making them susceptible to disruption whenever there's a deviation in the naming of exam or series descriptions. A common occurrence when new equipment is obtained, scanner software is updated, or a new hospital or imaging center is added. In this paper by Shi et al. In the journal Digital Imaging, researchers discuss how federated deep learning can be used to automatically detect body parts within radiology images to improve the reliability of hanging protocols and the retrieval of relevant prior examinations. The current standard for encoding body part information in DICOM headers has limitations due to variability or missing data, leading to improper labeling and organization of images and potentially overlooked prior exams. AI, specifically federated deep learning, can analyze imaging data directly to more accurately identify the body part being examined, thereby enhancing the consistency and accuracy of hanging protocols. Now that Jonathan's examination has been acquired and images are displayed using the appropriate hanging protocol, it is finally time for the radiologist to interpret the images. Imaging interpretation, however, should not occur in a vacuum, but rather with comprehensive patient history and clinical data. The EMR is the repository for vast amounts of this patient information, including clinical notes, prior operative reports, laboratory and pathology reports, patient communications, and prior imaging reports. Reviewing this data is overwhelming, particularly with ever-growing imaging volumes. AI can analyze Jonathan's clinical journey, highlighting previous findings, correlating laboratory results, and presenting this curated information succinctly to the radiologist at the moment of imaging interpretation, tailored to the specific examination. This AI-driven AI-driven contextualization empowers the radiologist with targeted knowledge, streamlining the diagnostic process. A study published this month in Nature Medicine from Stanford University highlights how advanced AI can assist with the substantial documentation burden in healthcare. By tailoring language models to clinical summarization tasks, the researchers demonstrated that these models could provide summaries equivalent to or even better than those by medical experts. They investigated 8 large language models across 4 clinical summarization tasks: radiology reports, patient questions, progress notes, and doctor-patient dialogue. With the application of prompt engineering and in-context learning, they fine-tuned models to adapt to specific medical contexts. The research found that model-generated summaries achieved higher scores for completeness, correctness, and conciseness compared to medical expert summaries. It's worth noting that the LLMs were not merely performing simple information retrieval tasks. They were actively synthesizing and summarizing complex medical data, a task that typically requires significant domain expertise. This marks a significant step forward in integrating AI into clinical workflows, potentially reducing clinicians' workload and allowing them to dedicate more time to direct patient care. A crucial and often overlooked step in radiology